Hope Channel, changing lives.
And you are welcome to the consulting room. We are live on Facebook and on YouTube, and we are also live on Hope Channel. We are here as usual on Monday at 8 p.m. to have discussions about our health. And today we are going to talk about something that is quite overlooked in our circles, especially the Ghanaian setting. I'm sure you know a child or two. These children, they don't know, hey, stop. They don't know how to keep still. Some people grow out of those things, but there are some children that this becomes a very troubling thing in their life. So I hope you join us. As today we have joining us on Zoom, Dr. Gloria Amponsa Kodia. We've already had her on the show before, but then she wants us to know more about Enquirano Maniso. So today she's joining us on Zoom. And if you don't remember, she's a pediatrician at the Ejiso Government Hospital, and she's also with the Healthy Kids Foundation. And with me in studio, I have Miss Irene Kekeli Amegbanu. Hey, I'm sorry, I don't want to spoil your name. She's also a speech and language therapist with Talking Tips Africa. So as the show goes on, you get to hear a bit about Healthy Kids Foundation and Kids Eden. I hope I said it rightly, Dr. Amponsa, and a little bit about Talking Africa too. So you are all welcome to the consulting room.
Thank you.
Okay,
Thank
so
you.
we'll go for a very short break. When we come back, we'll get to know more about ADHD, attention deficit hyperactivity disorder, and you can get some tips from there and help your children. So do well to join us when we come back.
Dairy-free coconut milk. Cocoa dairy-free coconut milk is a fully plant-based milk, non-curdling in tea or coffee, and it's a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Cocoa is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Cocoa, get one today. Cocoa dairy-free coconut milk. Nature's health at your doorstep. For bulk purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Cocoa dairy-free coconut milk.
The consulting room on Hope Channel, and I think some of you are watching us on Facebook and on YouTube because you are live. As the discussion is going on, if you have any questions or any suggestions or anything at all bothering your mind, you can send them to us on text 055-968-0066. It's also on the screen so that you can easily send us your messages. So a lot of children get beaten up, especially in this part of our world. And if it wasn't for the fact that I have been educated on this, I used to think So what exactly is ADHD? Because now on social media, especially TikTok, a lot of people are claiming they have ADHD. And if you've not really, if you don't know what ADHD is, you might think it's something so common. So what is it, and is it that common? Dr. Gloria?
Okay, thank you, Mami, and good evening to all your viewers.
Good evening.
ADHD is attention deficit hyperactivity disorder. Is one of the neurodevelopmental disorders. I will explain that shortly. And there are some key features that characterize this condition, which I also talk about. So when we say something is a neurodevelopmental disorder, when a baby is born, they basically just cry and eat.
Yeah.
And then as they grow, they start getting certain skills. So they learn to talk,
Yeah.
they learn to walk. When they are much younger, when they start walking, they are running all over the place. And then by 3, 4, 5, they get to know that okay, I need to sit down. I'm in public. I need to sit down and then focus on what is happening or what I'm doing.
Yeah.
And then a number of other things that they develop. Um, there are some children who do not develop some of these. Okay, so we
Okay.
say these children have developmental disorders or neurodevelopmental disorders. So ADHD is one of the neurodevelopmental disorders. So
Okay.
a little bit outside the norm of development. And there are some things that characterize this condition, some key features. One is hyperactivity.
Okay.
So these children are always on school, hyperactivity, and then the other is inattentiveness. So these are children who find it difficult to focus and then complete a particular task.
Yeah.
And then also we have impulsivity. So these children would just do whatever they want to do. They have difficulty waiting for their turn or thinking through whatever they want to do. They just are impulsive. They do what they want to do. So we have hyperactivity, we have inattentiveness, we have impulsivity in children. And for you to say that a child has ADHD, there should be at least 2 settings where these features manifest.
Okay.
So if a child is very calm, obedient in the house, and then when he goes to school, that is when he's all over, not doing his work and all that. That child may not listen, which is keeping the child disciplined, and then something is happening in school which makes the child is stimulating the child to behave that way. So there should be it should happen in multiple settings, not just one setting. So that should be present. And then it should also be seen before the age of 12 years. So it starts when the child is younger, is developing. And so if you have somebody who was developing normally, was sitting down, doing his or her stuff, and then after 12 years, now can't do all that, you can't say that ADHD. You should have started seeing, should have persisted for more than 6 months. It should have persisted for more than 6 months for you to say that it's ADHD. So these are some of the key features, and it should also impair the person's function. So the academics, their social interaction or things that they are supposed to do socially, and other aspects of life. So that should be impaired. And of course, you should also see that it's excessive for the child's age, because as I said, when they are much younger, a 1.5-year-old child who has started walking would want to run around. When they are in public, they are in public, they want to run around. But if a 6-year-old is doing something like that, then it is abnormal for the age. So you have to ensure that the symptoms that they are manifesting out. So impulsivity, inattentiveness, hyperactivity, yes, but the other things must also be satisfied for you
Okay.
to make a diagnosis of ADHD. And I think you asked how common
Yes.
it is.
Yeah.
It's very important we know about ADHD because it's quite common. I mean, it's not uncommon at all. There was one study that was done in 2014, 2015 in Asante Achim North.
Oh, in our own
Some of the
country.
schools,
Okay.
yes, in
It's
our own
nice when we
country here,
have data
Ghana,
that
here.
we can relate to locally.
Yes, yes, we do. We do. And they found that the prevalence, so the schools that they selected and did a study on, they found that it was about 7% of the people. So that is 7 out of every hundred
Yeah, that's
pupils
quite
would
a
have
number.
ADHD. That's quite high. And there was another study that was done in 2017 in Hohoi municipality.
Okay.
And they even found a higher figure. So that was 12.8, almost 13.
Wow.
So 13, yes, 13 out of every 100 children in the schools that they screened had ADHD, met the criteria for ADHD. So we had 7 here, we had 13 here. Even if you want to strike an average, that would be like 10 out of
Yes. Yes.
100. And that is 1 out of 10 children.
Yeah.
You understand? So one out of every 10 children. So if you are in a class and then the class size is about 30, you are a teacher
Imagine
and you
having
have
three
about
of
30
these.
students. Three,
Yeah.
exactly. Three of children may have ADHD, and you should know about ADHD so that you can pick up these symptoms in these children and then help them or direct them to the appropriate help.
Oh, okay. So now we know that ADHD is very common. What brings it about? Is it that maybe when they were giving birth to them, the wires touch Miss Irene?
Okay, so for ADHD, as at now, there's no known cause of ADHD, but then research shows that it's genetics.
Okay.
So if you have a family member, maybe the mom, the dad, or there's a history of ADHD in the family, the likelihood of you giving birth to someone with ADHD is very high.
Okay.
So when it comes to a cause, there's no known cause, but then with the genetics, yes. If you have a history of ADHD, the child likely would also be ADHD.
Okay, so apart from the genetic aspects, are there any other things that puts a child at risk of getting affected with ADHD, Dr. Gloria?
Okay, so there are quite a few. Prematurity is one of them. So if a child is born premature, the chance of that child having ADHD is higher. It doesn't mean all of them would have it, but their chances are higher compared to somebody who was 10.
Okay.
And then also exposure to nicotine or cigarette smoking
Okay.
is also a risk factor. So that is also something we should look out for. And then also there are some drugs that when taken in pregnancy, and one of them is antidepressants. If they are taken in pregnancy, the chance of the child also developing ADHD is quite high.
Okay.
So these are some of the few risks.
Okay, so now we know that having it in your family, it means that you can pass it on. And if unfortunately you gave birth too early, well, I'm sure those of us watching who have some of these things in our family will start taking particular note and not overly abuse these children, because that is where my issue is. We just, our society is quite unforgiving to children. We just hit them on the head and just make matters worse. Okay, so moving on with the conversation. What are some of the things that could make some of the practical things that can make either a teacher, a caregiver, your grandmother or some, so what are the practical ways that you can start thinking that probably this child could be having ADHD, Dr. Miss Irene.
Okay, thank you very much. So, for instance, in the classroom, a teacher, when the child is always fidgeting, they like to run around, they can't concentrate on one activity. So, we are doing numbers, and then within a few minutes, they are running from that to go and do something else. They are not moving along with the class, flowing the class. Then, and if that behavior affects their classroom education, then you know there's a problem. And then at home, same thing. A child may, you see, ADHD presents with hyperactivity, and so they have a lot of energy. They are moving around. Some of them have difficulty communicating their needs. They are frustrated. So this is where speech therapy comes in, because they have difficulty communicating their needs. So someone might bang their head on the floor. They might throw themselves on the floor just to say, I want water.
Okay.
But because they can't communicate what they want, so they are doing other things. They are passing it through other things to communicate their wants and their needs. And so when you see such things, you should run to the nearest doctor, hospital. Of course.
Dr. Gloria, so if I start noticing these signs in my child, the person is, as you said, in the class running up and down, and in the house too cannot sit still, what should one do?
Yeah, so it's very important that the child gets an assessment done. And we always stress on early intervention because the brain is malleable. You can easily rewire it when they are younger. A phenomenon that we say neuroplasticity. So the brain is malleable. You can shape it at that young age. So it's important that the child gets an assessment done. It's not everything that looks like ADHD, which is ADHD. There are some things that also, would mask it. So you may have a person in class who is sitting still. So even with the HGAD, we have the predominantly inattentive type. So they may not be running up and down, but they are sitting in class and they are not, their mind, they are not concentrating on what is being taught. They are daydreaming. So their grades are always poor. So that's the predominantly inattentive type. So they just have difficulty focusing on a task and completing it. They are very forgetful. They easily get distracted by the slightest thing, and they lose their things easily. Okay, very short memory. You tell them something, and then the next moment they've forgotten. So those ones, you may not see them running up and down, and you may think that they are okay, but they may have ADHD, the predominantly inattentive type. So if the grades are poor, it's important that you alert the parents and then get the child assessed. There are also times that they may, as Irene talked about, they are just hyperactive. So they're predominantly hyperactive type. That one, it's easily seen because they are all over the place. You can easily see that one. And then we have those that have the combined type. So they are not paying attention and they are hyperactive. If you see this in your child or in your student, let the parents know and then let the child assessed by a pediatrician or a psychiatrist. And there are some questionnaires that we give to the school, and then we also give to the parents. So there are a set of symptoms that they usually have. So we ask them whether they have those symptoms, and then they tick and they grade. And when we put together what the school says and then what the parents are also saying, then we can make an assessment and say that, okay, this child has ADHD or this child doesn't have ADHD, maybe something else. And we also have to exclude other things because there are other things that may make a child not pay attention in class. Maybe they move to a new environment, maybe there's a breakup or separation in their home, or things are not going on well. So that can affect a child. A child may not be sleeping well. That can affect their concentration and then their performance at school. So when they come, we try to rule out all other possible causes of their hyperactivity or their inattentiveness.
Okay.
And then when they answer the questionnaire, so like I said, it should be in more than one place. So when you get the same thing happening in school, the same thing happening at home, and then you put them together, then you can make a diagnosis or an assessment that this child has ADHD. So
Okay.
it's important that their parents to send them to a pediatrician or a psychiatrist to have them assessed.
Okay. So, is ADHD curable? And I want you to relate it to your work. How do you help patients that have ADHD as a speech therapist?
Okay, so ADHD is not curable, neither is it preventable, but then we can put in treatment plans, educational plans that will help the child manage their symptoms better.
Okay.
So the role of the SLP is to help the child communicate, as I said earlier on.
SLP being?
Speech language pathologist.
Okay.
Or sometimes we say speech language therapist.
Okay.
It's the same thing. Okay, so we are there to help you to help the children manage their behaviors. There's no medicine for speech. There's no medicine for French, and so in speech therapy there's no medication. But then there are activities and measures we put in place to manage things that we see. So when you come to us and then we assess you, we assess your receptive language, your expressive language, your social skills, your turn-taking skills, which are things that may be affected when the child has ADHD. So when I say receptive skills, I mean how well the child understands what you say. When you ask your child to go bring you something, are they able to do it?
Okay.
So that's your receptive language. And so when the child is able to do that, then you know, oh, okay, they have some form of receptive language. But if they don't, then you work on that. And then when the expressive language, how well they express their wants and their needs. So I said, since they have, they're impulsive, they're inattentive, they're hyperactive, and those who are like non-verbal, they can't communicate their needs. So you assess that, and when you see there's a deficit there, then we come in and then we help them. And then their turn-taking skills. So because they are impulsive, they don't wait for their turns.
They just do it
They
as
just
they
do
feel.
anything they want to do, yes. And so we come in, and then there are a lot of activities that we do that will help a child learn how to take turns in their society. Then we also assess their play skills. So play skills, when you take a car, how does the child play with it? Do they throw it around, or they push it on the floor? They go back and forth with you. So we assess all those things, and then if those things are not in place, there are also activities that we do that will help build all those skills. And so every child is special. So like Dr. Gloria said, some of them, they have just the inattention, others is just the hyperactivity, and then others is the combination of both. So depending on the outcome of the assessment, then we do our management.
Okay,
Yes.
all right. So, Dr. Gloria, as a pediatrician, what do you also do when you are managing such children?
Okay. So in addition to directing them to a speech therapist when their speech is impaired or their language development is impaired, and one of the key things is that usually these children attain the language quite late, so they lag behind their peers. Even if they achieve it at all, they usually achieve it late. So speech therapy is very important in their management. And then we also direct them to a behavior therapist, okay, or a psychologist who will teach them that when you want something, request for it, and then you wait and have it, and then when you get it, you say thank you. They teach them how to behave well, because sometimes these children, they just cut in when somebody is talking. They won't wait, they just barge in. So they have techniques that they use. So behavior therapy, they teach them, okay, if you do this, you focus and you complete your task, you will get this. So reward, they use reward system so they to get them to behave and do what they are supposed to do. You know, the teachers and then their parents to break their tasks for them. So don't give them too much work at a time. They will get confused. So a little at a time for them to complete, and then you add more to their task. So that is where the behavior therapy comes in. And then
Okay.
when that is not working well, then we give them medication. So
Okay.
what happens is that in the brain, uh, like it's an organic problem. So it's not like a spiritual or the child is just pretending he's a
Yeah.
bad boy. He will
Yeah.
not say that. You know, so now I look back and then I think some of my classmates in the primary school were beating. I just
Sorry.
think so maybe they had ADHD because there were people whose names were always on the list of talkatives. They were all over the place, wouldn't sit down and all that.
I'm
So
sure most
that
of us
that
had some of these people, one at least one person in every class.
you know every so they like I said, it's very common.
It's
It's just that we
common,
don't
yeah.
pick it up. So they are beaten today. Tomorrow they will get up again and then
Yes.
talk and they are being moving. So ordinarily children, I mean, once you discipline children because it's an organic problem, they don't have control over it. They keep doing it over and over again. What happens is that research has actually found that the executive function, so ensuring that they sit down and then think through a task and complete it. Though the parts of the brain that controls this, there's reduced activity in these
Okay.
children
Okay.
compared to their peers who do not have
Yeah.
ADHD. And then there's also this chemical which is produced by the brain which helps you to focus, pay
Okay.
attention, and then complete something. That chemical too, we don't have they don't have them in adequate quantities. Okay. So it's just like if somebody has diabetes and they are not producing adequate amounts
Insulin.
of
Yeah.
insulin
Yeah.
and we give them insulin or we give them drugs that will help
Then producing.
augment the little
Yeah.
insulin. That is what we do in ADHD. So for those that have very bad cases, which are not, which behavior therapy is probably not helping, we give them medication. And what it does is that it increases that chemical in the brain, which is supposed to help you to focus, sit down, focus, and then perform a task to completion. We give them those drugs that help. And like I said, just like you'd give insulin to somebody with diabetes, just like you give other medication, antihypertensive to somebody with hypertension and all those other medications to the other conditions we have. That is what we also do in them to focus and then to complete the task and pay attention and then finish whatever they were supposed to do. So that is what we do. Behavior therapy, medication if necessary, and then of course the other things like speech therapy for those whose speech are also impaired, and then play, which also helps them to take turns and to wait for their turns and all that.
Oh, okay. That's quite interesting to know. So is there ever a combination of the behavior, speech, the non-drug therapies and the drug therapies, or you have to do one when it fails before you go to the next?
No. So when it comes to therapy, when we find out that the child doesn't just need speech therapy, but then they might need occupational therapy to deal with their sensory issues, their attention, because the occupational therapy would teach them how to redirect their energy to something profitable. and not just run around and all that. And so we have kids who come to Talking Tips who do both behavior therapy, speech therapy, and then occupational therapy at the same time, because it's linked. Speech therapy, occupational therapy, and behavior is linked. So you don't finish this to do this, because we all need to work together. So that's when the multidisciplinary team comes together to work with the child to get a good prognosis from that child.
So children with ADHD, do they have to be sent to school for children with special needs? Dr. Amponsa?
Now, what we are pushing for, hoping for, is inclusive education. Children learn better with their peers. So even if they are struggling, they are lagging behind in their language, their self-care skills and all that, when they watch the other children who do not have these deficits, they learn. So now there's a lot of work towards inclusive education. So you have a child in the school who has special needs, and then the school, the teachers know that these are the needs of this child, and so let's help him in this area. So we do that. We actually want them to be part of the mainstream classroom or mainstream schools, but with the help they need. For instance, so that child who has ADHD in class should be seated very close to the teacher. You get it? So that the teacher can keep an eye on that child. And it should also be, you should have children surrounding him. So the one sitting on his left, his right, behind him should not also have ADHD. Otherwise, you'd have trouble in class. So these are children who should be of good behavior and would actually not do things to distract that child. And the teacher should know that this child cannot do so much in, sit still and do so much in a short time. So you give them breaks, so short tasks, and then you let them have a break before they come and then do another task. So we are actually pushing for inclusivity because it helps the children. They are better, they learn better, they overcome their challenges better. But the school teachers, those handling the children, should know, the friends or the classmates should also know that these are the challenges this child has, so that they all work to help that child overcome those challenges.
All right, that's very good to know. So we have to make sure that these children are part of the mainstream.
Of course.
Well, I hope their classmates don't bully them too much or more than necessary, and I hope the new breed of Ghanaian teachers are more receptive to these children, as we all want to be better members of society. So we are going to go for a very short break again. When we come back, there's this new thing where every parent is giving their child a laptop, a tablet. I want to know if this has any bearing at all on ADHD. So if you want to know more about this, when we go for the break, do well to join us when we return.
Dairy-free coconut milk. Cocoa dairy-free coconut milk is a fully plant-based milk, non-curdling in tea or coffee, and it's a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Cocoa is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Cocoa, get one today. Cocoa dairy-free coconut milk. Nature's health at your doorstep. For bulk purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Cocoa dairy-free coconut milk.
Are you looking for a show that motivates, encourages, happens to be full of fun? Very interactive, and above all, bring you an inch closer to God?
Year 1975, I was baptized at Hanson Road.
Oh.
And since then, I have remained a Seventh-day Adventist.
Then, Readings of Life is here. We talk to your favorite personalities, we give you top music videos, and the fun part is we involve you by asking Bible trivial questions. All of these and more will be coming your way right here on Hope Channel, Ghana.
To the consulting room. Today we are talking about children that might be having too much energy or they are hyperactive. We are talking about children that cannot wait to do things as other children do. They just do things on impulse. We are talking about children that cannot, you can't have their attention for more than a minute or two, because something will pass by and they would lose focus. We are talking about how to make life better for these children. So if you have a child like that, whether you're a parent, you're a caregiver, or you are a teacher, or you just know somebody in your community with something like this, we have Dr. Gloria Mponsa-Kodia and Miss Irene Kekeli Amegbanu who are teaching us more about ADHD and what to do to help. So right before we went on the break, I mentioned something about how technology is a good thing. If it wasn't for technology, a lot of people wouldn't have access to this information. So yes, it's a good thing. But now a lot of parents, especially parents in the urban area, and now we already know that people are migrating to the urban areas a lot. Almost every child in almost every school is either having a phone, either having an iPad or a tablet, a laptop, something, and they are exposed to all these things. Some people claim it can cause ADHD. Some people don't think so, but I want to know what Dr. Gloria thinks about this. Is it linked, screen time and ADHD?
Okay, that's a very, very good question. So as I said, there's a problem with the brain in ADHD.
Okay.
Excessive screen time has a link, but it is not a causal link. So it's not the excessive screen time that will cause ADHD.
Okay.
Children with ADHD would manifest those symptoms, whether you let them have excessive screen time or not. However, excessive screen time can worsen the symptoms of ADHD. And actually, excessive screen time can worsen attention in all children, whether they have ADHD or not. Okay. And now the recommendation is that for children less than 18 months, they should not have any screen time at all. Zero screen time.
Oh.
This morning I was talking.
Then a lot of crutches are in danger.
Exactly. So people should know children less than 18 months should not have any screen time.
Dr. Mponsa, is 1 year, 6 months. Before someone goes to think 18 months.
18 years. So it's 1 year, 6 months, 1.5 years. They should not have any screen time at all. That time, children should be in their environment. So no screen time at all. And then after that, from 1.5 years, they should have a maximum of 1 hour of screen time a day. Okay,
1 hour.
1 hour of screen time a day. 1.5 to 5 years. Now, for those who are 6 years and above, I mean, some of them may actually use it to learn. They need it to learn,
Yeah.
especially remember when COVID came, a lot of schools were doing Zoom learning and all that.
That's true.
So from that age, you expect that they may need it more than an hour, but it should be well structured. Parents should know what their children are watching or using the screen time for, the gadgets for. And they should know that if it goes beyond a certain point, their children are straining their eyes, they are getting neck pain and back pain, which are all side effects of excessive screen time or use, then they should stop. And even those ones, so for 6 years and above, where we didn't put any time limit, there should be breaks in between. So about 20 minutes, you take a break before you come back. But you the parents should monitor what goes into that. So screen time is excessive screen time does not only affect children with ADHD, but every child. And for those with ADHD, it actually
Makes it
worsens
worse.
their
Okay.
symptoms. This is what happens when a child gets a lot of excessive, a lot of screen time. It can affect their sleep. So this light, which emanates from the screen, actually affects the production of a certain chemical in the body, melatonin, which helps you to sleep.
Yeah.
So if you have a child with ADHD who is always glued to the screen, their sleep, they may have impairments when it comes to sleep. They may not sleep well. And even as an adult, if you don't sleep well, you when the following day your day is like spoiled. You can't focus very well, you can't think through things very well. So how much more a child who has ADHD? The inattentiveness will worsen. When they don't sleep well, they are more hyperactive during the day.
Yeah.
So excessive screen time will not cause ADHD per se, but it can affect the symptoms. It can worsen the symptoms. It can worsen the inattentiveness. It can worsen the hyperactivity. So it's important that children with ADHD we regulate their screen time.
Okay, that's good to know. So don't just push your children to one corner in the hall and tell them, "Koshe TV, the laptop, no, go and play with your tablets." I think we have to find more innovative ways of engaging our children. Well, Harry, not someone, sorry. Harry from Cape Coast has a question. He says, what about children who make lots of noise at night? Is that ADHD?
Lots of noise. What kind of noise?
Dr. Gloria, Irene is saying what kind of noise? Please.
I'm just wondering, is it in their sleep? Is it
Well, there was no,
wait,
there's nothing else here. So I don't know
he's
if
talking about
Harry can send a detailed explanation to what he means. Anyway, back to the conversation. So, what role do parents play in the management of ADHD, Miss Irene?
Okay, thank you very much. So when it comes to managing ADHD, the speech therapist, the occupational therapist, or the behavior therapist are like coaches.
Okay.
Because even when you come to us, the most we can spend with you is 45 minutes to 1 hour.
Oh.
Yes, and so the rest is left to you because we spend more time with our kids at home and in school. And so the parents, teachers, we all come together to work to help the child. So the speech therapist will give you recommendations, what you could do at home to help your child build on their communication, their turn-taking skills and all that. And then so the parents play a very, very, very important role in the management of ADHD.
Okay, that's very good to know. And just as we are having this discussion about children and they having healthy lives, I hope you know and you remember that cocoa milk is good for everybody. It's good for adults. Pregnant women can take it because it has no preservatives, no chemicals. It's lactose free. It's everything free. just that it's not free. You buy it in the supermarkets around you. So do well to go for cocoa milk whenever you are out shopping. So Dr. Gloria, is ADHD preventable? Can we prevent it from happening?
Okay, before I go to that, let me also add to the role that parents play. And then I would also say teachers, because teachers also spend a long time with the children. Parents have to know that to get a child to do what you want them to do, it takes a lot of effort. So when they accomplish a task, you praise them, you reward them, and it helps them, it motivates them to do more. So you realize that a child who could sit for only 5 minutes, I mean, when they sit and then they finish what they are doing, you make it as if, I mean, that's the greatest thing in the world.
Yeah.
And then next time they will increase it to 6 and then 7. So praise and reward is very important when it comes to helping children with ADHD overcome the symptoms. And then also giving them smaller tasks. So don't say, go to the room, open the wardrobe, there's a bag there, open the bag, bring this and all that. So smaller tasks, as they improve, you can increase the number of tasks you give to the child as they go. And then also, as I mentioned, sleep is very important. So make sure they get adequate sleep, at least 8 hours a day or in the night. Very, very important. So parents should make sure their children get good sleep.
Okay.
As much as possible, without refined sugar and all these preservatives from their diets. Let them have a whole, unrefined meals. It's very important. These meals are good for everyone, not those with ADHD, everyone, even adults. So when you give to the child, a child with ADHD, a lot of preservatives, these food coloring,
now almost all the drinks on the market is just sugar and color with the little bubbles in it.
And all that, it doesn't help them. Those things are not good for anyone. And then there are actually a lot of studies going on to look at how those things affect them. But for now, the recommendation is that take them out of their meals. Let them have adequate sleep. And then sometimes some of them may have zinc or iron deficiency. They've realized that when you also supplement these kids with zinc and iron, it also helps them, it improves their symptoms. So talk to your doctor, your child's doctor, and let them get the right preparation that contains the right amount of zinc and iron for them. Exercise also helps them. So when they are restless, they are feeling restless and all that, let them go out, run around a bit, and then it also helps to get them more focused. When they run around and they sit down, it helps them to be more focused. Now, talking about the whether it's preventable or not, it's really difficult to say I'm preventing ADHD because of the strong genetic association.
Okay.
So when you have a child with ADHD, it's possible that somebody in the family has it too. There was one grandmother who actually told the doctor, the man was so worried, sent the child to the doctor, and then the grandmother was also there, accompanied them. Then the grandma was like, "Oh, doctor, papa, we are crying. Papa, no, sad, no, you get it." So, this man may now be exhibiting fewer of the symptoms, and the child is having, it's difficult to actually prevent it because of the strong genetic association. What we recommend is that you look out for the symptoms and then we intervene early. The other risk factors like prematurity, so we can reduce the risk to some extent if your child is born at 10. And then also the exposure to cigarette smoke, and then
now
making
shisha.
sure that you don't take.
A lot of ladies are taking shisha and
You may not even know that you are pregnant. These ladies may not even know that they are
At
pregnant,
all.
and then they will be taking it before they realize that the child is already exposed to it. So
Yeah.
avoiding all these things and then other unprescribed medication in pregnancy can also reduce the risk of a child having ADHD. But
So
you can't say that you are preventing it in
okay.
100%
Okay.
that strong genetic link.
So this is just a follow-up question because of the example you just gave about the grandma of the child telling you that Jana sana not here. Do people grow out of this hyperactivity, inattentive? Do they grow out of it either with or without therapy?
Okay, so about 20%, just a small percentage of them may grow out of it.
Okay.
And especially during adolescence. So during adolescence, there's a growth spurt, and sometimes there's also significant growth in the parts of the brain that regulates executive function,
Yeah.
or executing a task.
Mm-hmm.
So some of them, a small amount of them, may grow out of it, but a significant number would still carry it into adulthood. The symptoms may differ a little bit. So you may not have the adult running around and all that,
Mm-hmm.
but what you may see is an adult who um, engages in risky behavior.
Okay.
So they may get into the usage of drugs, risky sexual behaviors, and then you may also have them, if they are driving, they will just cross to the other lane without even checking, the
Yeah.
impulsivity. They want to get into the lane and then they cross without checking if there's a car coming. And these adults, they also have difficulty sustaining a job or keeping a job because they usually don't follow through with the instructions and leave the job undone, and they may
Okay.
also get into trouble with their co-workers because of the impulsivity. So you may not see them running all around, but they would exhibit these symptoms. But a small number of them may actually be able to outgrow it.
Okay, so we have about 4 questions and we have barely 8 minutes left. So we'll quickly attend to the questions. Then you can both talk about Healthy Kids Foundation and Talking Africa. So the questions quickly. Someone is asking for your contact because he has a 3-year-old child that cannot speak. So I'm sure when we get to the talking about your foundations, you can both give out your contact. So the next one is, please, my 10-year-old boy with the condition is doing so well. He loves reading, but I really don't know if he understands what he reads. And what I have realized is sometimes he tries to talk more than he can. And when the words are not coming, he gets offensive. How do I help him? So any of you can take it.
Okay.
All right. So, Irene, you
Dr.
can go
Gloria, you
ahead.
can go.
All right. So the thing with these kids is that they find a lot of things boring, and so they will not engage in those activities. But when they find something that they really are interested in, they really concentrate. You get it? So some of them love music. Some of them may also love arts and then other things. So when they are doing things that they love, they really concentrate. I mean, more than 100%, if it is, you get it. So this child who maybe enjoys reading may find other things boring. And so as parents, as teachers, as doctors, as therapists, we try to help them strengthen their strengths where they do well. Some of them are very good at maths. So you encourage them and then you help them to do more there. So this child, 10-year-old, is doing well with his interests, finding out whether he understands what he reads. I'm sure Irene will talk more about it, receptive and then expressive language.
Okay.
Can understand what they read or not. So I'll say that when they get aggressive because they are angry, they are not getting what they, it's all part of the impulsivity.
Oh, okay.
And so that's where you need behavior therapist or a speech therapist to come in.
Okay. So our next question. Someone is asking, and he's called Dominic. He says, please, it seems all the children of our days are very aggressive, even those in the villages. Is it not because of these general injections given to them after birth? Miss Irene.
General injection.
I'm sure they mean the immunization and all those things.
I don't think they have any effect.
It doesn't have any
link.
Dr. Gloria, the BCG they give at birth and all the polio and the 5.
Those things, well, for now, there's nothing, no research showing that there's a link. So for now, the scientific evidence is not there.
Okay. In Pong, I hope I got Pony or yeah. I'm a nursery teacher, so what I want to know is, can I relate the stubbornness of most of my pupils to ADHD?
If she listens to the conversation from the beginning,
hyperactivity,
there are differences between them. Some of them outgrow them, some of them is normal, and so if she really listens, she will get to know.
Wow. Okay. So just a minute to talk about where you are from.
Okay, so I'm from Talking Tips Africa Foundation. We are located in East Legon, around ARS runabout, and then we have OTs and then speech therapists there. So you can contact us on Instagram and then on our website, Talking Tips Africa Foundation.
So even on Instagram, it's Talking Tips
Africa Foundation.
Okay, so yes. Contact them on Instagram. Dr. Gloria.
Yes, so we are Healthy Kids Foundation, and we have a Facebook page that has a lot of information on child health. And we also have Kids Eden, which is a center, a learning and therapy center for children with developmental delay and disorders like ADHD that we talked about, speech delay, and all the other developmental delays and disorders. So we have a number of people. We have speech therapists, we have occupational therapists that help the children to have acquire those health skills like feeding, toilet training, and all that. We have a psychologist who helps with the behavior therapy. So children with ADHD who need behavior therapy can come there, and then we would help them. We also have a pediatrician. We have a psychiatrist. We also have
like a contact so that we can quickly broadcast it before we go off?
Yes. So let me just say that what makes our center unique is that we also have early childhood teachers who also teach them what they to know. So our contacts at Healthy Kids Foundation, 0540 45 9687, 0540 45 9687, and then the Vodafone number is 050 625 1093, 050 625 1093.
Okay, so I don't know if Talking Tips has a contact that you can give us. Oh, all right. So I'm very grateful to both you, Miss Irene and Dr. Gloria, for joining us today to talk about ADHD. If you have any concerns or issues, you can reach out to the studio, the Hope Channel studio, and we'll get in touch with you. And if you have any child that is hyperactive, is impulsive, is running around, giving you headache, don't beat them. Send them to the doctor for assessment, the pediatrician, for assessment. And you never know, maybe you not even need drugs, just the therapies would help. So let's all keep this in mind, especially our parents and our teachers, and let's help make the world a better place for everybody, especially our kids. So join us next week Monday here in the consulting room as we will be bringing you more interesting topics. Have a good evening.